And then I would like Lori to tell us how they help in California. So Lori Lane.
Hi, everyone. Hi, everyone. Thanks for having me. If we could put up my slides, please. And while they're doing that, so what a journey it's been for all of us in Palm Beach from when we started it to where we are today. It's been exciting. And, you know, ever since we got our first check, and I'm sure everyone, David and Dr. Hansen and Lou and everyone on the call, all of us have been like, wow, we wish everyone, you know, could participate in what we're participating in, not only on the financial side of it, but just around the better quality of care and sort of control you have over your practice and your office. When you really get good at doing value-based care and you opportunize on value-based care. So what we did was we took all of the things that worked at Palm Beach ACO, and we now have them, and we implemented those ideas into ACOs across the country. So I'm going to go over that really quickly. Some of them we started from scratch. Some of them we took over of failing ACOs to turn them around. So I'm just going to go real quickly from the basics and through what we do, and I'll be happy to answer questions at the end. So the basics. So an ACO obviously is like-minded physicians that come together on their own with other healthcare providers, and they want to better the delivery of healthcare. They want to increase the quality of care that their patients are receiving, and they come together with a plan, and hopefully they're successful at executing and implementing that plan, and they reap the benefits, both the patients do and the physicians do. Coordinating the care is really, you know, it's not to prevent care. I think Dr. Hansen mentioned that before. We do not recommend that you do or don't do anything for your patients. We don't demand anything one way or the other. We basically use the data and logic, give it to the physician, and the physician makes the decision at the level of care with their patient in front of them. You know, every patient's different, and every medicine has always been an art, always will be an art. So you can't make it totally scientific based on data, but we actually just give the patients the physicians the data so that they can use it to give better care for their patients. So that's what we do, and that empowers the physician to sort, especially primary care. Most of our ACOs, almost all of them, are centered around primary care practices, because we believe that you do need sort of someone to steer the ship, so to speak, or quarterback the team. The whole continuum of healthcare is considered the team, but someone really needs to be calling the plays. And we believe that the primary care physician is the ideal person for this. And that's the basis of our plan in our ACOs. Next slide, please. Next slide, please. Sorry. Perfect. So we currently are actively managing. Oh, perfect. So down at the bottom, you can see, sorry, the assignment to ACOs come from Medicare fee-for-service patients. That comes directly from CMS based on the plurality of care of that patient over a previous 3 years or whatever the Medicare determines. It's graded on a per member per month expense. And our goal is to decrease that per member per month expense of every patient that's assigned to your practice. And most of it happens, like I said, in the primary care setting. And one thing we do not do is we do not allow quality to suffer. It's one of our biggest concerns when we implement any of our intentional actions and actionable reports, is to maintain quality for the patient. Then if we save money, CMS, based on the contract that you have with CMS, does share that portion of savings back to you. Next slide, please. So these are currently active, where we're fully managing these. There are 6 total with 65,000 fee-for-service Medicare lives. We were successful in all of our ACOs for shared savings. which we're excited about that, with a quality score of over 90% for all of them, and with 3 of them actually being over 95%. At Advanced Management, we are managing all ACO track types, whether it be basic or enhanced, and even DCE contracting, if you're interested in that, which is new to the market, we are doing that as well. But really quick, so you can see we also do different types of ACOs. GW Health Network is a large academic ACO in out of George Washington Health Systems in DC. And then we have some smaller ones, which are only independent physicians, like at Doc ACO Gulf Coast, things like that. So we do every type of practice, every type of ACO, and our policies and procedures, they tend to work in all of them. So we're happy about that. Next slide, please. So how do you get the added benefits of really being good at value-based care and when you align with an ACO? So I'm gonna go over our keys to success. They haven't changed since 2012 when we implemented PBACO. They remain the same. And sometimes they seem very basic, but we really focus on these things. And at the end of the day, it does us all well. So we'll go to the next slide, please. One thing I think we heard mentioned before, the numbers are increasing in Medicare Advantage, and there's a lot of new ACOs popping up and DCE popping up. So all of us are going to end up in some sort of value-based payment system. I think that is the future and where CMS wants us to be. Whether you choose it or not, you're going to end up in one. So we encourage physicians to get in one, a successful one that has the same goals and vision that they do as a practice sooner than later, just to get on the band wave and keep it going as all the other practices sort of fall into line. So this is our proven formula. Our top 5 priorities, again, they started from the beginning and they have remained the same without wavering on them. We gain and help you retain your patient assignment. That's what CMS gives us based on your practice and the plurality of care of your patients. We focus hard on unnecessary inpatient admissions, not necessary ones, just the unnecessary ones. We reduce Medicare Part B, urgent care over EDs, institutional charges over outpatient centers. We monitor the home health agency spend and the length of stay. We really look at those 485s. We teach our physicians how to read them, how to say no to some of the things that are on them if it's not medically indicated, and use that to their benefit. We also closely watch skilled nursing facility utilization, length of stay, readmissions, things like that. All of that we give out in reports to our providers that based on their market, and they can actually see, all of their patients, where they went, how long they stayed, how much money was spent on it, were they readmitted, all of those things. It's very black and white in our reports. Every market in the United States has different sort of expenditure patterns, and we will identify in specific markets the lowest hanging fruit, so to speak, and then actually help that market overcome those overutilized area. For New Jersey, SNF is 4 times the average of fee-for-service patients. But in Miami, it's home health that's 4 times the average. So we're able to be nimble and adapt to the market and help those physicians thrive in their own market to control cost and provide better quality of care. Next slide, please. So some of the things that also, other than our basic 5 priorities that we focus on a day-to-day basis, and we teach our physicians to do as well, what else sets us apart? We really believe and are convinced that physician engagement is key. Without it, you can't get an ACO to work. If the physician doesn't understand why you're doing it, doesn't believe in the cause, they're not gonna think about it when they're in front of the patient. They're not gonna think about it when they're looking at 485s. They're not going to answer the phone, at 5:05. They're not going, and that feeling is not going to trickle down to their staff. So we feel that an engaged physician is our biggest weapon, and we work really hard to keep the physicians engaged. And we do see that engagement and enthusiasm around value-based care and increased quality trickle down to their staff. And that way you have a whole office. It's like a well-oiled machine, just working really good around providing patient-centered value-based care. So we do it. We assist the physician in doing that we have an ACO call center. We assist you with calling and scheduling patients. We do it based on what your preferences are. We schedule annual wellness visits. We schedule our high risk, high cost patients. We help anything that you want us to call and schedule to work on, we can do that for you. We have the ACO Super App, which all of our technology and analytics team is an excellent team that works really hard and can put the data in these reports and in these apps that you can quickly use to give better care and provide higher quality of care. So the Super App connects with the HIE in your area, and we get instantaneous messaging for patients that hit the ED or admitted or discharged. And that gives you the ability to act quickly to get them in for TCMs or to call and ask why the patient's in the ED. I just saw them yesterday, what's going on? Those types of calls can make the difference between an unnecessary admission. If you could see the patient that day or the next day, the patient doesn't have to be admitted, and sometimes when they're admitted on a social admission, everything can go wrong. They can get, a medical error, which leads to longer stay, which leads to then, a 21 or 30-day SNF stay, and then, a 60-day home health stay. So it's sort of like this domino effect. But if you can prevent that, which is our main goal, it makes a big difference. So that ACO Super App is hugely important to our physicians and to our savings. I talked briefly before about the actionable data reports that we give. They're very specific to your practice, down to the NPI level, whether you're 1 or whether you're 100, we break it down to the NPIs and to the patient level, exactly where your patient's spend is happening. And you can identify why and make sure that it's indicated and keep it going if it is, or make changes if it's unnecessary. When you're in an ACO, you get quality reporting, so you don't have to do all of that yourself. We do it for you. Well, we assist you and report it for you. Our team will help you get all of that data put together, and then it all gets submitted at the ACO level. And then we have physician consultants. You have them assigned to your practice specifically to help you manage all of these things and all of these reports that you might need. There's a lot of technology. Like I said before, there's an analytics tool, there's the Super App, there's a care tracker we'll go into briefly. And the consultants help you understand it, help your staff keep their hands around it to make sure that every patient is getting the right amount of attention that they might need. Next slide, please. So I mentioned briefly about our call center. So it's been a huge benefit because it's almost like having another FT in your own office, basically just calling your patients that need to be called to check on them and get them in to see you. We call for annual wellness visits. We call ER frequent flyers. That's one of our actionable reports. Patients that hit the ED on an average higher than normal. So we'll recommend that you call them, or the call center calls them to make sure they're okay, so that they don't end up in the ED over the weekend when you're not available. High risk patients, we do touch calls for them weekly, and routine follow-ups. We also do that as well. We also do the eligibility verifications on the annual wellness visit when the patient is eligible and which level of annual wellness visit are they eligible for that year. This has been huge for our practices. Like I said, it's basically having another FTE without having to pay them. It helps them maintain their assignment. It helps them increase their assignment. It helps them boost their fee-for-service revenue because we're getting more patients in for you to see and take care of. and it improves the quality of care because you're actually, you know, a lot of times you don't realize when a patient, you haven't seen a patient in a while. You know, they slip your mind, and before you know it, it's been 6 or 7 months on a patient with 3 or 4 chronic diseases. And that's really not where we want to be. But when the ACO call center is on top of that patient, that doesn't happen. So the quality of care increases for that patient as well. Our team currently does over 400 calls and audits a week per employee. So that's about 2 to 3 times higher than the offices that do it themselves. So that's one of our, one thing that does very well for our practices is our call center. Next slide, please. Our data reports. So in the center there, you see the data report schedule that we run, and around it are some of the examples. So I talked about the ER frequent flyers is what we call them. And we'll send you a report on the ER visits by day of the week and who they are, which patients. There on the bottom is a market level report. We can run market level reports, and we do on SNF, home health. We can run it on just about everything, specialist even, but we mostly release home health and SNF, so you can see who you're referring to. What is their quality score with CMS? How many admissions of your patients did they take? What was the average spend? What was the average length of stay? What were the readmits that home health had? Very, very useful information. And again, we don't, like I said, so you'll see here some are red, some are green, and some are blue. So we'll highlight those at the top. Probably the top third are going to be green, and the top, you know, the middle are going to be like yellow, and then you're going to have these red ones, which are performing below what we would consider a satisfactory performance. We don't mandate that you don't use the red ones, or mandate that you do use the green ones, because some of those you might really like the service that they give. But what we do encourage you to do is have talks with them and show them their data, which we can help you do. Our consultants do, and our team at Advanced does that as well. You know, listen, your readmissions are higher than anyone else in your market. You know, I need to get that down. I need to have more communication with you about my patient. So that's how we improve care in the market, you know, on the whole, and everybody benefits. The home health company benefits because they provide better care, the patient benefits, and the physician benefits. So really, I mean, really actionable items here in these reports that your staff and you will learn to look forward to seeing so that you can get busy working on them. Next report, or next slide, please. So I'm going to give you a practice that we came into an ACO. It's a case study, and we're going to use real data for when they started and where they finished in 2020. So this is a four provider primary care practice. It's a group practice that joined the basic track, one of our basic track ACOs in 2018. They had about 2,500 Medicare attributable lives, and their per member per year exceeded the regional by 5%, with their historical benchmark by 18%. So not performing very well. Their TCM visits are only at 23%, and 30-day remits were at 14%. They utilized paper charts, but had a practice management tool to schedule. Very disorganized in the office. Didn't know where their patients were. Basically, patients called, they got an appointment, the doctor saw them, took care of whatever they were there for, and they left. Maybe didn't have a follow-up, even with chronic conditions, didn't have any of that. They had problems with their patients just going to the emergency room for things that could be treated in the practice. And a lot of this was around the disorganization and practice not knowing where their patients were, and access. All of those were issues. So next slide, please. So we put this particular practice into what we call a performance enhancement series. So not all of the practices are star performers. Some of them struggle. A lot of them struggle, but we have, for those that do struggle, we identify them early and put them into what we call the PES, or performance enhancement series. And we give them a little extra attention and a little extra help on accomplishing, some of our goals. We give them a list of 8 or 9, and we ask them to pick, 5 or 6 of them, and that's what they're going to really work on to improve on. So this particular practice implemented the same day, next day guarantee at their closest ER. The same day, next day is another tool that we utilize. So that means that their ER understood that when their patient hit that ED, and there's a letter signed by the practice, that they could call that doctor and say, listen, I have Mrs. Jones here. She's complaining of, let's say her blood pressure is really high, whatever it might be. But the ED doctor knows she doesn't need to be admitted. He could probably admit her. It's an admittable diagnosis because it's really high, but he knows she probably doesn't need it. So he knows that this provider has the same day, next day guarantee on file. So he picks up the phone and he calls that provider and says, I have Mrs. Jones here. I don't really need to admit her, but she does need to be seen right away. The provider says, yes, let me get her scheduled today or tomorrow. So then the ED physician can, write that in the chart, and he's comfortable sending the patient home knowing that she's being seen by her PCP same day or next day. Another very successful tool we implement, sorry, go back really quick. Another really successful tool we implement in all of our markets, we have teams that work with ED groups and to get these implemented, and it works really well. So this office also chose to have hands-on assistance from their ACO consultant, meaning that the ACO consultant would come into the office, sit with his team, be on his EMR, help him with all of his Medicare patients in his ACO that were having trouble. Basically, she became one of his employees, just like one of his team. They also got control of their panel. They learned where their patients were, who those patients were, where they were, and they scheduled annual wellness visits on them to accomplish all of the quality measures and to sort of anticipate future problems and put a plan of care in place based on what they find from that annual wellness visit. They monitored their hospital discharges with the super app to capture as many TCMs as possible. And then, of course, they worked their reports, drop patient reports, gaps in care, ED frequent flyers. So they worked really hard with our help. And if we'll go to the next slide, we'll see their improvement, which was incredible. So at the end of 2020, this practice, which came in as a poor performer, is in $1.5 million in savings, 5% below their benchmark. They scheduled over 78% of their annual wellness visits for the year. 80% is considered a gold standard, so they did very well. Their post-discharge visits and TCMs were up to 65% on all of their discharged patients. This is because they began using the super app, and they had an 88% usage, which is incredible. And they, with the assistance of our ACO and the management team, they implemented an EMR. So that's how we turned that practice around. That's how we basically turn ACOs around, is we practice by practice. We identify issues, we help them overcome them. And, the devil's really in the details, those small things that you don't think are important, they are important. And when you do them right every day and you don't, waver from that, you see the benefits. So we're seeing that in all of our ACOs across the country, and all of our practices continue to improve, patients improve, quality improves, and the physician does benefit financially because of all the hard work that they do. So that's it for me. Thank you very much. I look forward to questions if you have any when we're finished.